This is the Emergency Medical Minute.
Okay, so a quick medical minute on tPA for frostbite. So this is something that I actually didn't know too much about recently. I kind of, heard some patients who might be getting it, but I heard a little lecture about it recently. So in general, the idea is that frostbite is another condition where there's, lack of blood flow to an area. Usually it's the frozen extremity, and the problems, the downstream problems from frostbite are usually due to that lack of blood flow. So they started thinking that maybe we can give tPA to help open up the blood vessels and see if they can have better outcome for a frostbite and help with healing and prevent need for amputations. So there's been some studies that have looked at this. Some of them actually done here at University of Colorado, and they have found that there is an improvement in outcomes. And it's only given to patients who have what's considered, grade 3 or grade 4 frostbite, so 3rd degree, 4th degree frostbite. So either hemorrhagic blisters or 4th degree frostbite is really bad, where everything's like frozen and necrotic kind of down to like tendon or bone. So pretty bad frostbite. So not for the run-of-the-mill frostbites. And interestingly, it cannot be given until after the warming process. So it's not like they come in and you start giving the tPA, but it's given, once the extremity is warmed and kind of not frostbitten anymore, then the tPA gets given. And it is given systemically. There have been places that have looked at it doing intra-arterial, like through interventional radiology. But there's, most experts think that's better given IV, because even though there might be one area where it's the worst, a lot of people have, multiple areas of exposure. So maybe getting them systemic thrombolysis, breaking down all the clots that are forming and get blood flow better to all the extremities can help. So, it's something that we'll probably, I don't know if anybody's actually given it here, but I think we've gotten some patients maybe have gotten it and been transferred here. So that's the idea, is that there's, probably areas that aren't getting good blood flow. tPA can help with that, maybe improve the outcomes, prevent need for amputations in pretty bad frostbite cases. This is one of those things that maybe they'll do bigger studies and it might not pan out, but right now it looks generally safe and helpful for bad frostbite cases. Any questions? All right, thanks guys.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.